Medicare can feel like you're trying to crack a secret code with all its parts and letters. But don't worry, I'm here to break it down for you. Today, we're diving into the 4 main parts of Medicare: Parts A, B, C, and D. By the end of this video, you'll have a solid understanding of how each part works, what you need to do, and how to avoid any Medicare missteps that could leave you wishing you had a time machine. So, grab a cup of coffee, and let's demystify Medicare together. First up, we have Medicare Parts A and B, often referred to as Original Medicare. These 2 parts have been around since the dawn of Medicare itself. They're the foundation of the Medicare world. Medicare Part A is your hospital insurance. It helps cover inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care. The good news? For most people, Part A is premium-free. The bad news? It doesn't cover everything, like long-term custodial care. Plus, there are deductibles and coinsurance amounts that could leave you with some out-of-pocket costs. For example, in 2024, the Part A deductible is $1,632 per 60-day benefit period. Ouch, right? Then there's Medicare Part B, which covers your medical insurance. Think doctor visits, outpatient care, and durable medical equipment. It even covers some medications that you can't self-administer. But heads up, Part B isn't free. In 2024, the standard premium is $174.70 per month, which could be higher if you're a high-income earner. There's also a $240 annual deductible, after which Part B covers 80% of your medical costs. So, unless you have supplemental insurance, you'll pick up the tab for the remaining 20%. One more thing. If you delay enrolling in Part B and don't have other creditable medical coverage, you could be hit with a lifelong late enrollment penalty. So even if you're not seeing any doctors, signing up for a Part B is a good idea to avoid those pesky penalties. Now, let's talk about the wild card of Medicare, Part C, also known as Medicare Advantage. If Original Medicare is the classic rock of the insurance world, Medicare Advantage is the new band on the scene. Medicare Advantage plans are offered by private insurance companies that contract with Medicare. These plans bundle Part A and Part B coverage and often include extra perks like dental, vision, and even prescription drug coverage. That's Part D, which we'll get to in a minute. The catch? Medicare Advantage plans usually have a network of doctors and hospitals, so you must stay within that network to get the best coverage. And while many plans have low or even zero premiums, you'll still need to pay your Part B premium. But hey, for some people, those extra benefits make it totally worth it. Finally, we have Medicare Part D, which covers your prescription medications. Think of Part D as the sidekick to Original Medicare or Medicare Advantage. It's the Robin to your Batman. Part D is only available through private insurance companies approved by Medicare, and it can either be a standalone plan or bundled with a Medicare Advantage plan. The tricky part about Part D is that each plan has its own list of covered medications, known as a formulary, and what you pay can vary depending on the plan you choose. But don't worry, even the least expensive plans must cover most generic and brand-name drugs, like Part B. If you delay enrolling in Part D and don't have other creditable prescription drug coverage, you could be charged a lifelong late enrollment penalty. So even if you're not taking many medications, signing up for at least an inexpensive Part D plan is usually a good idea to avoid those pesky penalties. Navigating Medicare can feel like trying to solve a Rubik's Cube blindfolded. It's complicated and a little intimidating. But now that you've got the basics down, you're already ahead of the game. Remember, knowledge is power whether you're choosing between Original Medicare and Medicare Advantage, or trying to figure out the best Part D plan for your prescriptions. And if you still have questions, don't hesitate to contact a licensed independent Medicare insurance broker. They can help you navigate the maze and find the best plan for your needs. If you found this video helpful, don't forget to hit that subscribe button and ring the bell for more Medicare insights. And as always, drop any questions or comments below. I'm here to help. Thanks for watching, and here's to making Medicare a little less mystifying. If you have questions, Nevada Medicare Health is here to help with all your Medicare needs. Call 888-895-3267, email Darren Wadower at echos.care, or visit echosmedicaresolutions.com.